Good evening, everyone. And I'd like to welcome every one of you to our third webinar in the series of Understanding Mental Health. And tonight, we're looking at sleep and dreams. You may be surprised to see me sitting here tonight. I'm certainly not the eminent Professor John Geddes by any means. But I'm really pleased to be able to have the opportunity to present tonight's talk as he's unable to do so. We have two eminent guests this week, Professor Russell Foster and Dame Kristin Scott Thomas, who actually I would like to be slightly less formal about because they're good friends of mine, both of them. Well, I'd like to think so. And yet they're both huge professionals in their own field. Before I properly introduce Russell, I just wanted to briefly explain my involvement in this series of webinars. Strangely enough, many years ago, don't want to say how many, I was a failed Oxbridge candidate, very sadly. And 5 years ago, suddenly, they rang me up and asked for my help in trying to raise awareness and some money for their medical research department, most specifically in neuroscience and mental health. And in fact, I discovered whilst working with them that they are in fact the international leaders in this field. So I'm really proud to work with them. And it also means a huge amount to me personally, as I've lived a lot of my life experiencing mental health issues with both my family and also close friends. And in certain instances, this has very sadly resulted in very tragic circumstances. So for me, the opportunity to work with Oxford and their mental health department is hugely important. And I think to help highlight the issues that are facing us today and to try to further the work done to combat the mental health problems that we see today in our young especially couldn't be more pertinent today. Now, many of you this year may have well heard people talk about their sleep patterns in lockdown and their dreams during this pandemic that we're all living through. And so we felt it fitting to look at sleep and dreams and what it does to our personal body clocks and the effect that it has on our mental well-being. There's only really one person in the world that can talk to you about this, and he heads the Sleep and Circadian Neuroscience Institute. He's a remarkable man. He's discovered a whole area of the eye that we didn't know existed. He can show us how light controls our internal body clocks and also what that does to our mental well-being. And this man is Professor Russell Foster. But before handing over to this virtual stage to him, I'll just do a little bit of housekeeping. Russell will speak to us for about 10 minutes or so, and then I'll reappear again and introduce the lovely and renowned Kristin Scott Thomas. And I'll leave them in discussion for a while, after which there'll be a time for all of you to join in and to ask questions. This you'll do by using the chat facility on the bottom of your Zoom screens. And we will also, at the end, we've kept these last two talks very much to time and finishing after 45 minutes. But we felt that if anyone wants to stay on, I'll conclude it. But if anyone wants to stay on afterwards and ask more questions, you're really welcome. So Russell, over to you, and thank you for talking to us.
Many thanks, Dora. It really is a great delight to join everybody this evening. I will switch to my slides and we can kick off. Okay. Hopefully everybody will be able to see this. Is that
That's fine, Russell, we can see that, thank you.
Jolly good. Okay, what I want to do in the next 10 minutes is really give sort of a flavour for sleep and dreams. And first of all, talk about sleep biology and why sleep is important. Then talk about what happens if you don't get sleep. and then talk about the relationship between sleep disruption in mental illness, it is extraordinary that in most forms of mental illness, there will be some form of sleep disruption. And then finish by thinking about, well, why is that mechanistically? What are the mechanisms that sort of essentially lead to these co-problems of mental illness and sleep disruption? And does that provide us with some potentially new and exciting treatment options? So let's kick off with sleep biology and why sleep is important. So if we think about the different states of sleep and consciousness, they could not be more different. And it's stating the obvious, I know, but they are entirely different states. And the flip-flop between sleep and consciousness requires an interaction between all of the key brain neurotransmitter systems and multiple brain structures. And of course, it's those interactions that give rise to the REM, non-REM sleep cycle. And we go through 5, 6 of these every night. And it's in REM sleep that we have our vivid and most clear dreams. And of course, it's from REM sleep that we wake naturally. This complexity is in turn regulated by 2 timers, our biological clock, defining when we go to sleep and defining when we wake up. But it interacts with another timer known broadly as sleep pressure, which is sort of the intuitive part about sleep, which is the longer you've been awake, the greater the need for sleep, the greater the sleep pressure. And all of these systems interact to drive the different sleep-wake states. But the key thing I really want to address is, but what does sleep actually provide us? And I think that for so many years, sleep has been sort of considered as an indulgence, a luxury. And it has no profound value. And now we're beginning to understand that we couldn't have been more wrong. So in terms of bodily functions, we have during sleep the rebuilding of energy systems, the rebuilding of metabolic pathways, the removal of harmful toxins and waste. So for example, the misfolded protein beta amyloid, which is associated with dementia and Alzheimer's, is actually cleared from the brain and the cerebral spinal fluid during sleep. And also the brain is coordinating growth and tissue repair. But in terms of our cognitive abilities, sleep is critically important for developing memories, for emotional and cognitive processing, and indeed some problem solving. And I think these are such important domains that I just want to show you some data in this regard. So let's just briefly look at problem solving. Now, this is work not from our group, but from Jan Born from Germany. And what Jan did was develop a problem-solving task. And he did a number of experiments, but what I want to illustrate is the first group. He introduced them to this task in the morning, and then they performed the task in the afternoon. And you see that 20% of this group solved the problem. The next group were introduced to the task in the morning, but then performed it the following afternoon, but they were deprived of sleep. They had no sleep that night. And you see that about 20% solved the problem. The interesting group, of course, is introducing the task in the morning, performing it the following afternoon, but being allowed to sleep normally. And you see that 60 to 70% of the individuals could solve the problem. And I think this illustrates so beautifully that sleep promotes the ability to come up with novel solutions to complex problems, which is something that we all need at this particular time, of course. The second example is sleep memory and emotion. And again, this isn't from our group, this is from Sickhold's group. And what he did was compare 2 groups, those that slept normally and those that hadn't slept one night. So they hadn't slept for 36 hours when they performed the task. And the task was to try and remember words with a positive content, happiness, joy, love, negative content, war, hate, crime, or words with a neutral content, something like cotton or shirt or whatever. And so let me just show you the results. When all the words were lumped together, you see that the sleep-deprived group clearly remembered fewer words. But what's so very interesting is if you divide this column here on the basis of the neutral, negative, or positive words, you see that there was a tendency to remember fewer neutral words, but it wasn't significant. Strikingly, there was a tendency to remember fewer negative words, but it wasn't significant. The overwhelming result is that tired brains fail to remember positive words. And this is a lovely illustration of the fact that the tired brain has a negative focus. Let's now really emphasize this point, which is the quality of our sleep defines the quality of our wake, which brings us to the second bullet point, which is what happens if you don't get sleep. So here we have poor sleep, and poor sleep is associated with three domains: short-term sleep, long-term sleep disruption, and also if you have mental illness vulnerability, there's an exacerbation of symptoms. And of course, short-term sleep disruption, long-term sleep disruption, and mental illness vulnerability all interact. When I was preparing this slide, I thought, my goodness, it's like one of those sorts of angels that you play with in the snow. And so I sort of added a little bit extra here, because this is actually the avenging sleep angel. Because what short-term sleep disruption is associated with is microsleeps. 100,000 crashes on the American motorway system every year are associated with falling asleep at the wheel, loss of empathy, feelings of frustration, irritability, reduced creativity, poor attention, poor motivation, memory impairment, and negative focus and irritability. And many of us have experienced that. Longer-term sleep disruption, as you find in the business sector or indeed in night shift workers, is associated with physiological and psychosocial stress, immune suppression. One thing we know about the stress hormone cortisol is it suppresses the immune system, which presumably predisposes to increased infection and indeed even an increase in cancer risk, cardiovascular disease, stimulant and sedative use, metabolic abnormalities, and indeed diabetes 2 and obesity. And if we consider the last domain, mental illness vulnerability, we see that sleep disruption in individuals who are vulnerable increases the chances of mood instability, depression, anxiety, substance abuse, hallucinatory experiences, paranoia, mania, and feelings of rejection. So sleep loss and tiredness is not just the inconvenience of feeling tired at an inappropriate time, but it's associated with major short-term and longer-term health impacts. Let's now move to the third bullet point, which is sleep disruption in mental illness, and the fundamental topic of this series of lectures. It's really very important to emphasize that in all mental illnesses that have been described, depression, bipolar, schizophrenia, a very large number of individuals show clinical levels of sleep disruption. So in schizophrenia, for example, there are publications suggesting that greater than 80% of individuals with a diagnosis of schizophrenia are having a severe sleep disruption. Now, I got into this because I was in a lift with a senior London-based psychiatrist, and we were chit-chatting away. And he said, well, obviously, poor sleep in mental illness is due to unemployment. And I thought that was just a daft idea. And it actually triggered my interest in the field. And so we started to study sleep disruption in individuals with a range of mental illness states. And what we did, first of all, was actually explore his hypothesis that unemployment is causing the sleep-wake disruption. And of course, unemployment is a key feature of many severe mental illness states. So here is an unemployed individual, and what we see here is days. Each line represents a day. The time base is 48 hours. The black line is midnight. And we see here when the individual was active and indeed when they were asleep. And actually, this unemployed individual is showing a very stable sleep-wake pattern, which is broadly similar to most employed individuals. So clearly, unemployment per se is not causing a sleep-wake abnormality. And when we looked at individuals with schizophrenia, the results were quite breathtaking. I'd never seen anything like this before. This was perhaps the mildest example, schizophrenia 1, where there was lots of activity at night and sleeping during the day, to schizophrenia 7, where this individual was showing no 24-hour patterns, completely and utterly fragmented sleep-wake cycles. And what we found in schizophrenia is also similar in many other areas of mental illness. And furthermore, a disturbed pattern of sleep often occurs prior to either a depressive episode, and indeed studies that we have undertaken, we see that disturbed sleep actually is a predictor of the development of bipolar conditions. Okay, so let's now finish with mechanisms to treatments. I guess the point I tried to make earlier on is that this great complexity with all of these key neurotransmitter systems, brain structures, the biological clock, the sleep pressure, this complexity makes the sleep-wake cycle immensely vulnerable to disruption. And with these observations, and indeed increasing understanding of how sleep and wake and circadian rhythms are generated, led us to develop the following hypothesis: that sleep disruption and mental illness share common and overlapping neurotransmitter and brain circuits. And when you take that on board, and we have very clear evidence for that, that if there's a change in a neurotransmitter that predisposes you to mental illness, then it's almost certainly going to have an impact upon sleep at some level. So you will expect to see mental illness and sleep disruption linked. But of course, the sleep disruption, because of its distorting effect, its short-term and long-term consequences in our emotional, cognitive, and physiological health, can exacerbate the mental health state. And of course, the mental health state can, via its psychosocial and physiological stress activation and indeed medication, can disrupt sleep. And with this sort of framework, we could then test whether there were genes linked to mental illness and sleep disruption. And indeed there are. And in conditions such as bipolar, as I mentioned earlier, you see sleep disruption before any clinical diagnosis of bipolar. So by studying mental illness and sleep disruption in parallel, we're learning a great deal about the two biological systems. But also, I think what this suggests is that sleep disruption could provide a new therapeutic target in mental illness. And our question was, if you can minimize sleep disruption or reduce sleep disruption, will you reduce the severity of the mental health state? And I want to show you two sets of data, one by us and this one by another group. And this is an incredible study, and we're looking at depression on this axis here, and we see a drop in depression along this axis, and weeks are across this axis. And what the experiment was to use morning light, which is incredibly effective at stabilizing the biological clock and hence the sleep-wake cycle. So morning light was being used to stabilize sleep-wake. And let's look at the impact of morning light and compare it to, first of all, placebo. And you see that placebo, yes, does reduce levels of depression. And you see actually a very significant drop by 8 weeks. The second, I think, is really rather striking because this is Prozac. Prozac is only significant from placebo at 8 weeks. Now we look at light. And light was 10,000 lux for 30 minutes first thing in the morning. By 2 weeks, it was significantly different from placebo. And by 8 weeks, it was much more effective than Prozac. And in fact, if you combine light and Prozac, the effects are additive, suggesting that light and Prozac may be acting on different brain pathways. So here's a great example where sleep-wake stabilization is leading to a major decrease in levels of depression. And the final slide I want to show is work from Oxford, led by Dan Freeman in psychiatry. And this is reducing paranoia and hallucinatory experiences by improving sleep using changes in behavior. And we can talk about some of those changes later on. So we see in this case, paranoia increases from low to high. And we look at the control group here, where there is no intervention. And the levels of paranoia at the beginning of the experiment and after the experiment have not changed. We now look at the sleep correction using changing behaviors. And here we see the levels of paranoia in these individuals before the experiment starts. And then significantly, I've combined the 10 and 22 weeks data together, and we see a very significant impact in the reduction of paranoia simply by stabilizing or partially stabilizing sleep-wake. Okay, we've covered a lot of ground. And what I hope to give you some sort of flavor of is the nature of sleep, why it's so important. And essentially the take-home message there is that our sleep defines our ability to function during the day. And that was reinforced by what happens if you don't get enough sleep. And then this extraordinary comorbidity, this co-occurrence of sleep disruption in mental illness. And then a way to think about those interactions. And critically, the conclusion was that we can think of sleep as a new therapeutic target. Stabilize sleep, even partially, you can reduce the severity of levels of mental illness. So thanks very much for your attention.
Thank you so much, Russell. You never fail to amaze me how you can make a subject which is evidently incredibly complex actually quite understandable to us mere mortals. So I'm always amazed, and also I find it endlessly impressionable that tiredness just has such a major impact on our beings and our mental health, and you know, everything from feeling negative about things to immune suppression, which obviously is hugely relevant at the moment.
Yes.
Anyway, I don't want to delay and start.
Dora, one thing I was a little bit naughty though, because
yes.
I didn't touch on dreams, because I thought we could unpack dreams actually during the discussion. There's so much to discuss that I thought let's get the sort of fundamental biology, what we do know, and then we can speculate about what dreams are and what they may mean.
And I'm sure people will have lots of questions about dreams as well. So hopefully we will definitely tackle that. So I don't want to hog the stage and ask you lots of questions, but so I'd like to welcome Kristin onto the screen, who really needs no introduction to any of us, except that she's climbed an extraordinary, steady and stellar trajectory from winning BAFTA's Best Supporting Actress in 4 Weddings and a Funeral as Fee, as Hugh Grant's best friend and wannabe girlfriend, to her much anticipated role in the newly released production of Rebecca as Mrs. Danvers. Anyway, with all the success she has under her belt, let's see how much or how little sleep has played in the importance of Kristin's career. Thank you so much, Kristin, for joining us.
Thank you. It's really great to be here. It's so interesting. I've been a terrible sleeper ever since I had children. Before I managed to sleep terribly well, and then that all went out of the window. But I'm particularly interested in. I've noticed that since we've all been, you know, stuck in England, and I haven't been traveling, I haven't been zooming around the world. Don't suffer from jet lag, which means that I don't have those awful sort of holes that you fall into. And I was wondering if you could explain a bit about how that, why is it that we can, you know, you can wrestle with it like crazy, but it never seems to work. I've got some pills called No Jet Lag. They seem to work quite well, but I'm not sure whether it's just because the name inspires me.
Well, jet lag is a classic example of a mismatch between the internal day and the external world. And the internal biological clock is set by exposure to the local light-dark cycle. And we get over jet lag primarily as a result of being exposed to the new light-dark cycle, and that sets the clock, which then sets the sleep-wake cycle. That's the really important thing. Night shift workers, of course, are working out of sync with their body clock. And they're being forced to work at a time of day when their biology is saying, you need to go to sleep. And of course, they never adapt. The assumption has always been, oh, well, you adapt to night shift. You don't. Because of course, what's happening is that the night shift worker is exposed to dim light in the workplace and experiences bright natural light on the journey. And therefore, they almost nobody ever adapts. But it's light. And so traveling west, the rule of thumb is to expose yourself to the local light-dark cycle and eat when, you know, at the local time. Try and brutally adapt when traveling west. Mm. Traveling east is a bit more complicated. And the advice there is to avoid morning, let's say if you're flying to Sydney, avoid morning light for the first few days, and then seek out afternoon light. And you can wear dark glasses in the morning and then just get out and see night, light in the afternoon. And the logic behind that is that light does different things at different times of the day. Dusk light delays the clock. Morning light advances the clock. And of course, what you want to do if you're traveling to Australia is advance the clock, but your body clock is still on London time, and so you're hitting it at completely the wrong time. So the key thing is avoid morning light, seek out afternoon light, and that will more rapidly allow you to adapt to the new time zone. Melatonin is used by some individuals. It is pretty ineffective. It does speed up a little bit the rate at which you can lock onto local time, but it comes with, I think, I would be cautious. I don't use melatonin, and the pilots, for example, and air crews are advised not to use melatonin because it actually might interfere with the body clock in a way that is unpredictable. So I think it's light. It's light in the new time zone.
And that can literally be changed by covering your eyes, so not seeing light. So what happens with people who can't see?
Yeah, well, that's a really great question. And a lot of our research at the moment is working with the profoundly blind. And I'm honored to be a vice patron of Blind Veterans UK, extraordinary group of individuals who have suffered eye damage or lost their eyes as a result of combat, for example. And you're quite right, Christian, those individuals with severe eye damage have no way of locking their clock onto the external world. And I remember chatting to one chap and saying, you know, I know that Wednesdays are the day that I cut the lawn. But because he didn't know what biological time it was, and it was uncoupled from the external world, he woke up, thought it was morning. It was actually 3 a.m. And because he's a fiercely independent individual, he went out and started cutting the grass at 3 o'clock in the morning. And that's just a sort of a vaguely amusing example, but also these individuals are completely out of sync for big chunks of the time with their friends, their family, and their ability to work. It's like unremitting jet lag. And so our work at the moment is trying to understand how these new receptors we discovered are actually interacting with the biological clock. So we can develop drugs that will fool the clock into thinking it's seen light and then restore a sense of biological time to these extraordinary individuals. And of course, work on the profoundly blind could also feed into other groups. So for example, those pictures I showed of schizophrenia, perhaps we could use those drugs for a short period to stabilize sleep-wake and then perhaps nudge people into a less or a reduced illness state. So I think this is really a very exciting area, and these individuals volunteer and are remarkable.
Mm-hmm. And another thing we have been talking about, has been insomniacs who can't sleep but who nap in the daytime, which happens with when you're jet lagged as well. You suddenly think, oh, I'll just go and have 20 minutes, and then suddenly the 20 minutes becomes 3 hours and you're a mess. But I find, for instance, when I'm night shooting or something like that, which I absolutely hate, but I manage to sort of keep going by having these sort of little, I'm very, very good at just being able to relax, sort of switch off for 20 minutes, which is how I survive, basically, I think, when I'm doing those things. And so does that have this, do those 20-minute sort of bursts of shutdown, what happens in those 20 minutes?
Yeah. So what the nap is doing is pushing back the sleep pressure. Remember that hourglass thing that I showed earlier, which means that you are less tired. Now, what's interesting is that we're getting a better understanding of what sleep pressure actually is. The longer you've been awake, the greater the buildup of sleep pressure, the greater the sleep need. And there are substances in the brain called adenosine, which build up the longer you've been awake. And what's interesting is that caffeine in coffee actually blocks the receptors in the brain that respond to adenosine. So you genuinely feel more awake after a cup of coffee because you've actually blocked those pathways in the brain that would detect sleepiness. Now, a 20-minute nap has been shown to be extremely effective in reducing tiredness over a short time scale. The problem, as I think you've alluded to, is if it gets longer. Because if you go into a longer nap, you fall into deeper sleep, and then the sleep inertia, the grogginess that you experience recovering from a long nap is just hideous. And you also have to be quite careful not to have that nap too close to your desired bedtime, because what that will do is push back the sleep pressure and delay sleep that night. And this is classically seen in teenagers. So what happens is that they're doing social media until 2 o'clock in the morning. They eventually fall asleep. The alarm drives them out of bed at whatever it is, 7 o'clock in the morning. They struggle through school. They get home from school. Then they have a 2-hour sleep. It can't even be called a nap, which is relatively close to bedtime, which means it's much more difficult to get to sleep that night. And therefore that combined with social media. And so you get into a vicious cycle of longer naps and greater daytime sleepiness. And so short occasional nap, no problem. It's where it becomes, essentially you become dependent upon it for daily functions all the time.
And talking of napping and mental health, you know, there are some people when they're miserable, they'll go to sleep. And some people, when they're miserable, can't sleep.
Yeah.
So why do you seek sleep? And how does that work with PTSD? I mean, how does that work with post-traumatic stress disorder? I think that's what it's called.
Well, you've raised a really important point, because if you're sleepy, then sleep will cure it. If you have fatigue, then it's more complicated. Fatigue can be very much influenced by sleepiness, but it's also associated with other things. So depression is often associated with fatigue, this overwhelming lethargy, this lack of motivation, this sort of desire just to curl up underneath the duvet and stay there. And that means there's more going on than just sleepiness. There's an underlying health issue which needs much more serious attention. And so I think the key thing is really important to distinguish between the two. If you're experiencing fatigue, you need to sort of seek out clinical help, because it's suggesting some additional problems. Now, the other part of your question, which is post-traumatic stress, one of the brilliant young researchers in the group did some studies a couple of years ago where they exposed individuals to videos with sort of kind of traumatic images of funerals, images of car crashes and all the rest of it. And they then sleep deprived individuals after seeing that movie, or let them sleep naturally. And what was interesting is that those who were sleep deprived had fewer intrusional memories, fewer flashbacks than those that slept naturally. And that, of course, fits with our increased understanding of what's going on in the brain whilst we sleep. Sleep promotes the consolidation of memories. So we're not there yet, but it may well be that, in fact, the medical advice that we're currently giving, which is to promote sleep after trauma, may be replaced by actually promoting staying awake after a traumatic incident, so you don't consolidate those memories. As I say, it's still early days, but the data are very suggestive of that.
Interesting. All these things, like people say, sleep it off or keep busy. You know, all these things that you're told to do, and they all make sort of they make sense. But I'm interested in this sort of switch because in fact you think you're switching off, but you're not switching off, because you were saying to me a few days ago how your brain mends things while you're asleep.
Oh yeah, I mean it really is. It is quite extraordinary. I mean the processing of information whilst we're asleep really defines our creativity, to some extent our sense of humor, our ability to interact with others. And one of the interesting things that we should touch on, I guess, is dreams, and what they might represent. And certainly during the time of COVID, people have been reporting very many more and vivid dreams. And
but is that because they've got less to do the next day, so they can remember it?
Well, I think what's interesting is that we are sleeping longer.
Yeah.
And so we're waking naturally from REM sleep. I mean, most of us will be getting up, probably an hour and a half earlier, driven out of bed by the alarm clock, so that we can, get ready, then commute off to work. Now we don't have to. We just sort of put on a pair of pajamas or whatever, and we go down to the computer. So we're sleeping longer, which means we're waking naturally from REM sleep. And of course, it's during REM sleep we have our most vivid dreams, and so we're much more inclined to remember those dreams that we're having than previously. So that's I think probably why we're remembering more. But also the nature of those dreams I think is quite interesting. And a lot of people have reported very vivid and very stressful dreams. We don't really know what dreams are providing, but it's probably the brain trying to make sense of its world, and particularly trying to integrate our emotional and anxiety issues whilst we dream. And there's a very interesting study that was undertaken in New York after 9/11, when the Twin Towers were destroyed. People had very vivid dreams, but it wasn't of planes crashing into tower blocks. It was of being overwhelmed by a tsunami or being mugged. And so it's really fascinating. The brain is trying to sort of make sense of its world and the anxious feelings that we're experiencing.
And has this been going on forever, or is this to do with our sort of sleeplessness at the moment? Is it also because we're spending more time in front of computers? Are we overstimulating ourselves during the day with light, with special light from what's the sort of light thing?
Yeah, there's a lot of misinformation about light from computer screens and ebooks and all the rest of it. And the receptors that we discovered are maximally sensitive to blue light. And so, programs have been developed which shift the color from blue light to red light in the evenings.
Yeah.
But those receptors are incredibly insensitive to light. They need a great deal of light to lock the clock onto the external world. And a study from Harvard a few years ago looked at this empirically. And what they got people to do was look at an e-reader on maximum intensity for 4 hours on 5 consecutive nights. And it delayed sleep onset by 10 minutes. It was just statistically significant. So I think the light from computer screens and e-readers is not really the problem, although we do need a bit more data. I think the real problem is the content with social media, endless access to emails, where we're not winding down, we're not turning off. And it's quite fascinating that we think we can switch from the conscious state of all this processing to the sleep state instantly. We can't. We have to undergo a transition. And so, the rule of thumb should be get rid of those devices from bedrooms and turn them off at least 30 minutes before the desired bedtime. Begin to wind down. And I think that's one of the problems, because we can never leave work now. We've got access to our computers, the endless emails pinging in from across the world. And we've just got to be much more disciplined about it. Turn the damn things off and then turn them on again in the morning.
Yes, we wouldn't invite whole crowds of people into our bedrooms just before we go to sleep, would we?
I guess some of us might, but I wouldn't be one of them.
I thought just with the warning of turning those damn things off, I've just turned my damn thing on again. What a fascinating discussion. Thank you so much. I don't want to stop the flow at all. And having promised at the beginning that we'd do some questions, then I'd conclude and then carry on for those who want. We've actually got quite a lot of questions, surprise, surprise. So I think if everyone's happy, those who have to go, obviously that is totally understandable, but Russell and Kristen both have agreed to stay slightly longer than our 7:15 deadline. So if everyone's happy, I shall fire away with some questions.
Dora, but can I ask the first question?
Yes, of course you can.
So Kristen, one thing I've been absolutely fascinated about, I mean, you take on these roles and you take on these performances. does that influence your dream content, for example? Do you find you have strange dreams, or how does it affect your sleep when you become, in a sense, a different person?
I'm very unprofessionally, I don't dream in character. You'll be relieved to hear.
However, so is that method acting if you do?
Yeah, no, I think it'd be disastrous. God, it'd be awful. No, but what does happen is, because my rhythms and my lifestyle is completely out of whack, we're performing, particularly in the theatre, we're performing when a lot of people are starting to wind down. So we're building everything up. So if I'm on stage in an evening, it's very difficult for me to actually be able to sort of unhook before about 1 a.m. Yeah. And then, everything else is out of whack. And in the summer, it's really hard because, it's light and the morning's early. And so everything is and eating as well gets very complicated. The times of day that you absorb food is completely out of whack when you're on stage, and indeed when you're filming, because, you take it when you can. But I don't dream in character. I do dream in different languages, because I do speak French and English. And if I'm dreaming of a French situation, then I will dream that in French. And if I'm dreaming of an English situation, people are always asking me that, because it seems to be sort of something people are interested in. What language do you dream in? And actually, I find that language in my dreams is often, it's often not very, there aren't very many words in my dreams. It's usually just sort of actions and things like that. But, sometimes I do find myself speaking French terribly well in my dreams.
I mean, I guess you've seen it in your profession, but certainly in the business sector, that turning off after the end of the day, then the use of sleeping tablets and alcohol, for example. Yeah. Yeah. And what many people confuse is that these are sedatives. They actually do not provide a biological mimic of sleep, and they can actually inhibit some of the important pathways, such as memory consolidation. And then, of course, you have this alcohol-induced sedation from which you sort of surface, and then drive the waking day with endless caffeinated drinks and high glucose. And, kids, for example, particularly teenagers, that stimulant sedative feedback loop is really damaging. Sorry, Dora, I must shut up.
Don't worry at all. I've got one very quick question. I think it won't take long for you to answer, Russell. I think it's a point of clarity for one of our audience, and that is the question is: are you saying that unemployment doesn't cause sleep disruption, but it can cause mental illness, or are you saying it's unrelated to either part?
So if I was confusing, no, unemployment per se doesn't necessarily lead to sleep-wake disruption. I mean, it was always assumed that the social structure of getting up in the morning to for a job is critically important, and if you don't have that, then your sleep falls apart. It doesn't necessarily happen like that. And also, I'm absolutely not saying that unemployment necessarily predisposes you to mental illness. There are links, of course. The lack of social interaction, for example, and lack of esteem and the psychosocial issues of unemployment can certainly feed into depression. But unemployment per se doesn't necessarily result in depressive or mental health illnesses.
Thank you. And another quite quick one, I think, would you, for those suffering with mental illness, would you recommend the use of those sad lights, the white lights in the morning for 30 minutes?
I mean, I was deeply skeptical when these data first started to emerge, because, what you want is a control. You want an intervention. And what do? Stick somebody in front of a light box and don't turn the lights on. They kind of get the fact that they're the control. And then more sophisticated experiments relatively recently have absolutely convinced me that light, stabilizing sleep-wake, can, well, as those data I showed, have an impact upon the severity of mental health. It's probably more complicated, but I think disrupted sleep is a clear contributing factor. And if you can get that under control by whatever means, then I think you're going to reduce the severity of either the psychotic or the depressive state.
I've got quite a few questions about dreams,
Yes.
which would probably apply to you both. I'll try and lump them together if I can. And I think you touched on some of it already when you were both discussing REM and that sort of thing, which we've got. How can we remember some dreams very vividly, and quite often it's the negative ones over other dreams? Why, when on holiday, do one sort of retrospectively go back to different emotions of your past from quite some time back, and maybe when you're in a relaxed state they pop up? And then another one, which is, sorry, I probably hope not putting too many together, but another one on, are dreams an intrinsic good, i.e. is it a good sign when you dream and remember them, and is it a bad sign if you wake up and you don't remember it at all? So those are, hopefully you can disseminate what I've said.
We don't understand fully what dreams are and all the rest of it, but I think that having remembered a dream is relatively a good sign, because it means the brain is doing its job. It's trying to make sense of its world, and particularly one's emotional status. The fact that so very many of us don't remember our dreams suggests, to me at least, that they are not important in the conscious state. It's essentially the reworking of what's going on in previous experiences. So yeah, I think dreams are an artifact of the brain trying to make sense of its world. Whether we remember them or not, I don't think it matters particularly. They don't have predictive power. Many people say, oh, well, I dreamed, again, going back to the Twin Towers, you know, I dreamt of aeroplanes flying into buildings. Therefore I predicted 9/11. Well, actually, if you take a cross section of people at any time, there will be some people dreaming about planes driving into towers, and the frequency wasn't any greater prior to 9/11. So I think that I wouldn't worry about them. And I think the fact that we're having more of them is because we're sleeping longer and we're waking naturally from REM sleep.
What about the dreams where you wake up laughing, or you sleepwalk, or what about that? How does that work?
Well, yeah, now there's some very interesting things, because there are, during REM sleep, we're actually paralyzed from the neck down. We actually can't move. And there are conditions called REM behavioral disorder, where that paralysis doesn't kick in, and people have attacked their partners, have committed murders, for example, and done really nasty and obscene things. And they have not been convicted because they've been shown to have REM behavioral disorder. So they've actually physically acted out their dreams. Now, we also have sleepwalking, and that's during non-REM sleep, because we're not paralyzed during non-REM sleep, and many people will sleepwalk, particularly children, and then grow out of it. What does it represent? We don't know. And there's so many interesting things just going on, and I guess it's no great surprise. The complexity of the sleep state, you know, is going to throw up weird stuff from time to time. We shouldn't worry about it necessarily. The one thing that is a real issue, I think, for many is obstructive sleep apnea. And if your partner, for example, snores very loudly and then stops breathing, that's a sign that the musculature and the tongue are flopping back and blocking the airway. And that's really dangerous, because the brain realizes it's being deprived of oxygen. It then wakes you up, and you have these great surges of intake of breath, and then surges in blood pressure. And those surges in blood pressure have been associated, for example, to disruption in the small blood vessels of the eye. So if you do have sleep apnea, obstructive sleep apnea, you need to see a GP and get it sorted out. And it's easy to fix. You have a sort of CPAP, which is a sort of basically a mask which then forces air into your respiratory tract. And that, it takes a bit of a while to get used to it, but that cures it in 99% of individuals. You don't need surgery, you don't need other intervention other than the system.
I've got quite an interesting question here about meditation, actually. And how does meditation compare to sleep? in the way it facilitates healing and learning?
Yeah, that's a really interesting question. And I've implied that sleep is either on or off. We flip from consciousness to sleep. And one of my colleagues here in Oxford, Vlad Vyazovsky, has really pioneered an understanding of local sleep. So you can be doing exercise, for example, and part of the brain will actually go into a non-REM sleep state. And so what people are thinking about is that meditation actually might provide a sort of a partial sleep state. And what we don't know is whether after meditation or these local sleeps, for example, you've shown improved cognition, improved problem solving, or other increased memory, for example. There are hints that that is the case, but we don't know for sure yet. So meditation certainly is really very valuable for relaxation. And it may actually mimic to some extent certain aspects of sleep.
I can believe that. I mean, I've had times when I've been on a set in an uncomfortable costume and not been able to lie down, for example, been exhausted. And so I can go up to a wall and just lean my head against the wall and just have sort of, 40 winks. And it does, I mean, I know I'm not really asleep, but it's sort of it's not really dozing either. You go into this sort of muffled zone, which is actually really, really helpful. So I imagine that's a bit like the feeling that one gets when one's in meditation.
Yeah, and also it blends into states like mindfulness, where individuals are going to a profound relaxation state. Yeah. And I think these are really valuable because what it will do is change your stress milieu, and therefore can actually have huge benefits. I mean, if you can get your stress under control, you can, in many instances, get your sleep under control. Mm. And so many of us, of course, have problems turning off in the evening as a result of the stress axis still pumping out, stress hormones because of the demands of the day, yeah, or indeed the demands of the family for young mothers and fathers.
Yeah. Well, young mothers, for example, I mean, when you have your first baby, you just don't sleep. It just, and I think that's probably changed from and you don't sleep. Not only do you not sleep, but your baby doesn't seem to sleep either. So when does that start? When does a sleep pattern start? When does it start to settle? And when do you start to link your sleep, an adult sleep, with a child's sleep? And then a teenager's sleep, which is again.
Another. So it takes between 1 and 3 months usually for a baby to consolidate its circadian rhythms and its sleep-wake cycle. And the clock is ticking in many cases, but it's not being set to the external world. And it seems it takes a while for those projections from the eye to robustly set the clock in the brain. What's very interesting is that some studies have been undertaken which shows that mothers in particular lock on to the sleep-wake patterns of their baby, much more than fathers, it seems. And so the sleep-wake of the mother is particularly badly affected. Now, what I find interesting is that up until fairly recently, we've all lived in extended families. And we've moved in the past 50 years to the nuclear family, where it's a single couple and their children. And so what that means is the young mum doesn't have the chance to say, look, can you just look after the baby while I'm, to grandma, to aunt, to all the rest of it, to the extended family. Well, I just take a snooze. And in fact, it's even worse than that, because by reaching out, many young mothers feel that they're failing. Well, biologically, none of the primates is childcare the sole responsibility of the parents, and usually just the mother. It's an extended activity. And so I think it really is terribly important for young parents to understand they should seek help. And in fact, it's part of our biology to seek help during this profoundly taxing time in our lives.
And then teenagers, when you get to the teenagers, that's all wrong as well, isn't it? Sort of the time they want to sleep late at night and then late in the day.
Yeah.
We've got quite a lot, interestingly, we've got a couple of questions, Kristen, on that exact point, from people saying, is it a good idea to change the school timetable exactly because of that teenagers find it very hard to go to sleep at night, and as we all know, very difficult to wake up in the morning.
I think there are two elements here. There's sleep education in schools, and there's a delayed start time. I think it's extraordinary that 30% of our biology is sleep biology, and none of our schools actually provide adequate information about how we should prioritize sleep and how we should achieve better sleep. There's no sleep education, or very little, in the school sector. We actually introduced some sleep education, whereby we were able to train the teachers to teach sleep to their students. And what was very interesting is that in those kids who were suffering from poor sleep before the intervention, they showed a very much improved sleep after the. So arm the kids with the information, and their sleep will be better. Now, the argument for a delayed sleep time is complicated, because where it's been undertaken has been in the States, where classes can start at 7 or 7:30 in the morning, and kids are getting up really early to get the bus to get into school. And so what they've done is delayed start times to 8:30 in the morning. Well, our kids tend to go to school at 10 to 9. So we've already got a much later start than most countries, such as the States and such as Germany, for example. So my first line of attack would always be try and consolidate sleep by using education, rather than changing the school times, which becomes profoundly difficult, I think, across society. I mean, it's because of work schedules and all the rest of it. I think for some people, 20% of young adults, they really do suffer from sleep problems. And I think what we need to do is identify those individuals and help them through education and other means.
Thank you so much. Now, I'm very, very aware of the time, and we could really, I feel I could sit here all night, and there certainly are so many questions rolling in, but I fear that we should be disciplined and say thank you, and also to try to say to our audience that the questions that we have outstanding, that we will try to respond over the next couple of days, if Russell and Kristen would be kind enough to help us do that, but we'll try and put that together. So really, it remains for me to thank you both very, very much, and also to Saffron Wace, who is the instigator with me over this series of talks, which are slightly sort of morphed into webinars rather than live talks, and to Tom Stutterford from AGL Communications, who's helped all of us very much prepare for this evening. And my last note really is to say, which I know that John Geddes can't, is I'm always reminded by how lucky all of us are to hear from these brilliant professors, really. It's an absolute privilege, and they are leaders in their fields of expertise. And without them and their work, we really don't begin to stand a chance to solve all of these problems. And so I guess it leaves me to say, you know, if you can keep watching, invite all your friends to join us in the oncoming webinars. The next one's on the 17th of November on PTSD, and definitely arising from times of anxiety like COVID. And also, there are donation buttons. I don't like to have a begging bowl, but Oxford do really need support in this vital work. So thank you so much for joining us, and we look forward to welcoming you again on the 17th of November. And thanks again, Kristen and Russell. It's been fascinating.
It's been a great pleasure. Thank you, Dora. And we're putting online, I believe, a table of sleep tips. Is that right?
Yes, that's our going home present, although we're all at home. So we'll send it to everyone. Thank you so much.
Bye-bye.
Bye.
Bye-bye.
Thank you.